Hello and welcome everybody to another episode of the U of Care podcast. My name is Oliver Grandman and I am pleased and honored to share a few minutes with Dr. Ji-Won Chong and welcome her to the podcast. Welcome, Dr. Chong.
Hi, nice to meeting you. Thank you for having me.
It's a pleasure. I'm pleased to have you. Would you mind introducing yourself a little bit and what you're doing in general and what your position is at UF?
Sure. My name is Ji-Won Chong, and I'm an associate professor in the Department of Health Education and Behavior at the College of Health and Human Performance. I joined the UF in 2015. And currently I'm working on the substance use among adolescents and young adults, as well as the adults who are trying to quit or modify their drinking behaviors on their own without relying on professional help.
Wonderful. These are all very relevant and I think very important topics to discuss and address and study in our society today. And I wanted to ask you first, given your extensive experience and background, what actually got you initially into the field of substance use disorders?
Sure. I started my graduate study in South Korea as a social psychology major because I was interested in studying human behavior in the presence of other people and how we interact with each other and things like that. And I was really fascinated by the psychological approach, studying the complex human behavior in the clean, controlled experimental situation. So I spent several years there, but then later on, I felt there is something missing. That experimental situation is very the gold standard methods to figure out the causal mechanism of the behavior. However, I felt that we are dealing with just fish bones without the other parts of the fish. So I decided to study applied psychology and then moved to United States and then went to Arizona State University. And there I was exposed to the intervention and prevention science. And then I really liked the idea and wanted to join the sort of like collective force effort in helping people's health behaviors, improving the health behaviors using the psychological and theoretical evidence that we found in the experimental situation. And then I really like the idea that we can help people at a larger scale. So I stayed in that, area. But then soon, I realized that the data from the intervention prevention studies are not as clean as the experimental studies. So I needed to learn a lot of, the quantitative methodology and then all the biases that could happen in dealing with the real data set and real life data set and things like that. So my research interest kind of, got expanded to the methodological work, specifically the mediation analysis. So yeah, so I'm doing I'm currently at my research involved in two lines of program of research, I suppose.
Yeah, the mediation statistics or what is involved with that is very, and I think it is very well correlated or relates to substance use disorders in the real world setting. So can you tell us a little bit about the mediation factors or mediation strategies you're employing for substance use disorders and other research areas?
Sure. So, usually we know that, the independent variable affects the substance use behaviors, but then we want to know more in detail in between the independent variable and an outcome, what's going on inside, in between, in the process, right? So I guess the good example would be if you design an intervention study that try to change, let's say, improve the adolescents' resistance skills to drug offers and things like that. And then you want to know whether your intervention improved the resistance skills of the participants in your treatment group as you intended. And then that change in turn reduces their drinking behaviors, changes their drinking behaviors. So that is, we say X and Y. So there's a mediational pathways.
That is
Yes.
very interesting. Because what I've learned in terms of my much more rudimentary statistics skills is that we look at these different covariates that might impact how we kind of try to draw conclusions based on covariate analysis, but a mediator is different from that, right? It's directly causally involved in how the independent variable actually impacts the outcome variable, right?
Exactly. Yeah. So, it is easier to understand the mediation model if your independent variable involves some manipulation, like experiments or intervention or control group and things like that. Then the program is supposed to change the mediator. So there's a causal relationship that is assumed there. So yeah. If your intervention or experimental manipulation changes the mediator, and then the change in mediator affects your outcome of interest.
Yeah. So I would assume this makes some of these models quite a bit complex because you also have covariates. So you have kind of predispositions of people that kind of are already in place before you even intervene, before you introduce the intervention. And then some of these might actually become potentially mediators, right? Based on how I imagine this is getting quite complex when you get into the depths of it.
Yeah. So I guess if, again, the experimental manipulation or random assignment could help in there, because by doing the random assignment, other characteristics of the participants are supposed to be equivalent between the two groups. So that helps a lot. However, still we may have unsuccessful randomization. So you want to include as many covariates as possible so that you can accurately say that your intervention, it has some significant impact on the outcome or mediators, in addition to those potential the covariates that could confound the relationship. I'm getting too much jargony.
and I'm just trying to think about it like from an experimental setting approach, from real world evidence approach, that it can get quite complicated, because when we look at ourselves as human beings, we all have something that is different between us, right? So how do we categorize all of these different sociodemographics or other things, and then kind of try to draw correlations or make assumptions about something, and then the mediator kind of is impacted by the intervention and all of this. So I think it's a very complex but very interesting, and I think very relevant approach to looking at substance use disorders. Where do you think this fits into the larger scheme of maybe individualizing treatment of substance use disorders when we talk about a mediator?
That's a great question. I think if you approach the mediation with the individuals, I think you could rely on, I cannot think of any the data analysis way for the individual one person that way. But then if you have clear, I guess, the findings from the prior studies that clearly suggest certain mediation pathways, then you can focus on changing that aspects that are supposed to be the mediator in the one-on-one counseling settings, or treating one individual for their addiction behaviors and things like that. And hopefully you can see by looking at the trend of such characteristics of that individual patient or person, if you see the change over time, or trend in the change over time, then I think that could be adding additional evidence of that mediational pathways, I think.
Yeah. I think it's fascinating because we do something similar. I'm in pharmacy, so we do something similar with real world evidence and then individualizing patient care when we look at more of, enzyme expressions or stuff like that. And we try to individualize that based on the expression in the individual of that enzyme, which, excuse me, is a lot, I think it might be a little bit cleaner cut than the mediator variables, right? Or the mediators that contribute to the outcome that might positively impact the outcome or also negatively impact the outcome. And how can you then adjust for that? It's fascinating. Now you also focus on other research like HIV/AIDS prevention and intervention. Is that related to substance use disorders in some regard?
For the research that I've done on that area is rather limited. So because my role, one of my roles in my department is a methodologist, so I collaborate with my colleagues in the department. And so in that case, my research topic rely on the data set they have. And, for that, for those research, I use the data set that are available. And then rather than connecting it with the substance use, some of the studies that we did was looking at the factors that are, what are the reasons that the young people who do not want to get HIV tested.
Oh, okay.
So we did some the explorative factor analysis. I'm afraid that I don't remember the details of the findings, but that's what we did in the study.
I think also quite a relevant area of research. Why would somebody not want to know their status at some point? If we talk about, no matter what your sexual orientation is, to potentially expose their intimate partner to HIV at some point. I think it's definitely an interesting, and what can we do to change that, right? I think that it's similar to what kind of, going back then, since I might have touched on something that is not your central area of research at the moment, but going back then to substance use disorders, you are looking both at mediators or the impact on outcomes of an intervention in youth and adults. Do you see a difference in what kind of interventions work better for youth versus those who work for adults?
Based on our work with collaborating with my colleagues in the department, I think the big difference is that for adolescents, the peer influence is such a strong predictor of their behaviors, and that is similar to the young adults who are in their 20s. They are still strongly affected by their peers' feedback about their drinking. One striking difference is that for the adolescents, the parents' effect is still positively affecting their behaviors. In the young adult population, what we found is that their feedback on their drinking, whether they are drinking too much and, or, things like that, and then that affects negatively if they have more feedback, negative feedback, or mixed messages. Sometimes they, encourage their drinking, oh, drink, or sometimes, and then at other times, don't drink too much and things like that, then they drink more.
Oh.
So I think there is the big difference that we found. And then also when they are the young adults age, young adulthood, in their young adulthood, then another big social influence factor is the spouse and partners. So
yeah. So basically, as parental influence decreases, it's both peer and then spouse or a significant other that increases or somehow competes with parental influence on outcomes or on drinking behavior in this particular example. That's fascinating. So then the interventions might also be slightly different when they talk about how can we change certain behavioral patterns in youth versus or young adults versus adults. Have you yet found out what potential differences in intervention might work best?
Well, we haven't, but then, with the collaboration with Dr. Jaylee Tucker in my department and Ali Rasek, we are about to launch the web-based intervention for young adults who are not traditional college students, who may graduated already from college, but then they are not they are not full-time students. Then they may have their full-time jobs, or they may raise their own family and things like that. So we have this intervention based on the brief motivational intervention, as well as the behavior economic perspective. So we created the short intervention, and then we are in the process of programming that program. So yeah, we find that results will come back. Probably Dr. Tucker and the whole team can come back and present our results.
And I would love to read more about that as these new findings come out, because they might impact clinical practice when it comes to, and also the program might impact how, in addition to other interventions, it can be utilized to reduce alcohol use disorders in particular.
Yeah, that way, we can see what would be a critical component of the program for the young adults rather than the adolescents who are bounded in the schools and family.
Yeah. Fascinating. So before I let you go, and thank you for taking the time today, what do you think for your research is currently the biggest challenge that the research community is facing and society at large when it comes to substance use disorders and addiction?
So personally, the messy data set is the problem, the biggest challenge for myself as the collaborator and a researcher. In terms of the society, I think we may ignore some populations, such as the young adults who are not college bounded, and then also those who are trying to change their drinking behaviors, problem drinking behaviors on their own without relying on professional help. So in terms of the numbers in the population, I think those populations are larger than the college students or the people who check themselves into the professional and the facilities and things like that. So nowadays we have such a developed the technology. So if we utilize that development, the technological development, and then come up with some public health perspective intervention, then I think we could help a larger population who may have less severe problems, but busy with other life situations. And so if we come up with some low burden effective intervention, then I think that'd be great.
Yes, yes. That certainly would, I think, help, like you said, based on your research, a lot of people who might not necessarily perceive themselves as having a severe enough disorder, substance use disorder, that they need to go either inpatient or need to see necessarily a therapist. But it's still, and obviously with all of that, we have the stigma of a society that highly stigmatizes any substance use disorder. Although we have certain things that are considered rather legal, when you think about caffeine intake, for example, which some people might also develop a dependence or addiction to. So I think there is a lot of things when you think about substance use disorders where society may have to shift their opinions to make it easier for folks to actually receive the help that they need. So thank you, Dr. Zhang, for taking your time today. This is very interesting, and I really look forward to seeing future publications on what your research involves in substance use disorders, on the mediator, and the impact of mediators on intervention outcomes. So I really appreciate you taking the time today.
Thank you so much for having me. I enjoyed our conversation.
Thank you very much. And thank you to you all for listening. Look forward to a new episode of the U of Care podcast soon. Take care, everybody.
Bye.